All right, welcome, ladies and gentlemen, and thank you for joining us for the 10th edition of the Fireside Chat. My name is Garrett McLaughlin. For those of you who are new to this series, the Fireside Chat is a conversational webinar where we connect with some of the top professionals in the running, health, and medical communities. This week, we have Cassandra McCoy, who is a licensed athletic trainer around Tulsa, Oklahoma. Before we get started, let me cover a few housekeeping items. First, do us a favor and silence any technology around you. We really want to make sure you get the most from this chat. Second, I highly recommend asking questions. Of course, there'll be specific items we will cover during this chat as was outlined in the registration, but you are welcome to ask anything that will help you gain more clarity on this topic. Feel free to drop a question in the chat box now or at any point throughout this chat if something is on your mind. Lastly, if you cannot stay for the entire chat for whatever reason, or you just want to reflect back on this content at a later time, I will be sending the replay of this to you tomorrow at 11 a.m. Eastern time. Make sure to check your email and especially the spam folder since it can sometimes end up in there. So without further ado, Cassandra, thanks for joining us on the Fireside Chat. How's everything going this week?
Awesome. How are you guys doing?
Doing well, doing well. I know I don't say Oklahoma too often, so I'm gonna stumble on that one. So yeah, I appreciate you joining us from out there. So as we get started here, kind of interested in your background, learning a little bit about you, so the audience here knows kind of who they're listening to today and your background expertise.
Yeah, for sure. So I think on the second slide there, I have kind of my rundown. I am a licensed and certified athletic trainer here in Oklahoma. I went to the University of Oklahoma for my bachelor's and master's. I'm currently teaching at a local community college here. I teach applied anatomy and kinesiology and so much more. I founded Positively Balanced about 7 years ago, which is kind of blowing my mind that we're already at 7 years. Formally turned it into more of a practice last year, switching it over mainly from the fitness side, now doing more treatments. I've been in the health and wellness, specifically women's health setting for about a decade now, and I really enjoy it. I found out I had a passion for it, but even before I had my kids. And then once I had my kids, it just really just took it to new heights. So I'm a wife, I'm a mom of 2 amazing kiddos, and a fun fact about me, I own a farm.
That's awesome. And so what are some of the reasons you've developed this passion, obviously even before you had kids? Because I look at this area and this topic, and like we spoke about a couple of weeks back, and I think it's something so many people are really overlooking. So what really allowed it to pique your interest so you went down this route initially?
Well, it was personal health complications and just struggling to find answers. That kind of started it. My mom was also diabetic, so she already had her foot in kind of, being more health minded and stuff like that, since she was type 1 diabetic. And so that really kicked it off. But then what actually, I always blame her for this, we joke about it all the time. I had a friend and she reached out to me while I was in undergrad. She was like, I have questions. I'm trying to see if I can get pregnant. I'm having a lot of issues. Nobody can help me out. And obviously, that was out of my scope. That was out of my realm. I was just a fitness instructor at the time. And I was like, well, let me try to get some answers. Let me see if I can find those people who could help you. And that really started me down this path of like, oh my goodness, there's not much out there for women. We've gotten a lot better in the last decade, but especially then, I just, I was sitting down with her and we kind of started listing out some things that, she could start considering, people that she could contact. And I just decided I needed to know more. So I ended up going back for more education, went to several new courses that were coming out, just started diving into the literature, ended up going back for my master's, and then that's where we are today.
That's awesome. Yeah, it definitely sounds like you've especially taught yourself a lot, because I know through the research and what we spoke about was it's really not great when it comes to women in this topic of pelvic floor and postpartum and all of this. So Is there anything, is this improving now, have you seen over the last few years, or is it still a kind of a
Definitely.
missing area for many?
Yeah, we're getting better. The literature, there's people like Dr. Stacey Sims who are kind of champion, women are not small men. We need to be looking only, we need to actually look at what's going on physiologically and so much more. But then also, we have so many amazing innovators and thinkers that are starting to realize how much more information we need and what's lacking. We still are kind of behind on, some of the medical community, that medical lag, because, we get really behind on current research and stuff. So we see that, but I think it's going to just get better because we are seeing a lot of new studies started. We're seeing just a lot of awareness starting to take hold. And so that's part of what I do. I started a nonprofit branch of my company called the Be Heard Women's Health Platform. And so we actually are champions of like, okay, we need to talk more about multidimensional health, about, getting resources in the hands of women, just so that, they're not in the dark. They don't think, oh, I'm just like gonna be like this forever. They're given a little bit more knowledge, empowerment, and just hope for the future.
That's awesome. And just so I know, we'll probably cover this at the end too, but if people are looking for that information, where can they find that? Just so they know from the beginning.
Just head over to positivelyBalancedLLC.com, or you're more than welcome to follow us on social media, Positively Balanced, or myself, Cassandra McCoy.
That's awesome.
Yeah.
Okay, so to get us into the content then, could you teach us a little bit, like what is the pelvic floor? Like, I think we throw out this term and a lot of people still don't have a really good understanding of what that means. So can you describe that for us?
Yeah, so it's always termed like it's the stuff down there, it's what's not referred to. Especially, I mean, I'm in Oklahoma, the Bible Belt, right? It's not talked about. It's just like this hush hush thing, and it leaves a lot of people in the dark. And so it's really a deep core part of women. We don't realize how much it houses and how much it does until we look at the functions of the pelvic floor. And I want to list those out briefly just so that people get an idea of this unique muscle, because what pelvic floor is muscle. It's the floor of your canister, which we'll chat about here in a second, but it is a sphincter. It helps to create sphincters for the body. So whenever you are going to the bathroom, it is what helps to stop and start that flow. It helps to support your organs because it is at the base. And I don't know if you guys can see this here. I bet you can't, but there is the pelvic floor, like in that picture, and it supports all the organs just right sitting on top of it. It also helps to provide stability because it is considered a part of the core. It's just the floor of your core. And so it gives you that support and allows to help you manage pressure. But then also it is, of course, it has a sexual function because it has to contract and relax to sustain pleasure and more. And it's also a sump pump, which we don't really think about a lot, but it being on this floor setting, it's sitting on the base of your pelvis, it actually helps to push up lymph back to the heart, push up different fluids back up into your central, into your organs. And without that, it could be very stagnant in our lower abdomen. So it does so many different functions, making it really unique, even though it's not talked about very much.
Right. Yeah, no, the things you mentioned too, and like nothing that is commonly heard. And I think the significance of every one of those is, I mean, it's so great. So it's good to understand that. And so when there are actually issues with the pelvic floor, what are some of those things people will see? And I guess question here, because I'm probably the only male on here, is this something that men can suffer from as well? Or is it mostly a female issue? Or
yes, so a lot of these things that we're going to talk about today go both ways. Men suffer from pelvic floor dysfunction a lot more than I think is talked about, because I mean, guys aren't really going to say, they're not going to offer up this knowledge, just like females, right? It's not going to be widely talked about. You're not going to want to forthcome, yeah, I'm having issues down there. So there's a lot of literature coming out right now and conversations had that this goes both ways, both men and women.
Awesome.
Yeah.
That's good to know. Good to know. And
So let's talk about the common issues. So I kind of kept it very basic. And if anybody attending, please, jot down any questions, because we can really tease out some more content here for you and what you're interested in and concerned with. But biggies that I see in my office and hear from other women is incontinence. So that means that you are not able to stop the flow of urine. So this could be stress, or urinary incontinence being if you cough, laugh, sneeze, you kind of have that little flow of urine. Or maybe it's something like, I am stuck in the car for 4 hours and I can't hold it. So you have that urgency incontinence. Okay, so there's different things that can go on there. You also have something called prolapse. So if the pelvic floor is not adequately providing that support and stability that we talked about, you can start to have what is called a descent of your organs into the vaginal vault. And what that means, it doesn't mean that things are literally falling out. It just means that we have some weakness either in the pelvic floor or the supporting ligaments. And it is starting to kind of push inwards on the vagina. And this can be very uncomfortable, very frustrating for many individuals. And we can kind of unpack that more if we'd like to here in a moment. Obviously, one thing that I want to point out is pregnancy and delivery is very taxing on the pelvic floor. And we'll talk a little bit more about that here in a moment. But you're literally growing, the size of a watermelon on top of your pelvic floor. There's going to have that pressure, that function is going to be inhibited a little bit during pregnancy. And then no matter what your delivery was, whether vaginal or cesarean, it is going to have an impact on the pelvic floor. Another thing to note is back pain, which we don't really talk about as much, but this is highly tied in to pelvic floor dysfunction. A lot of my women who suffer from back pain, pubic symphysis pain, so much more, I can actually tie it in, especially when we're talking about adductors. All of this is connected to this base of our pelvis that houses so much. Another one that I wanted to talk about was diastasis. This one's tied in because it is the splitting of the abdominal wall in the front aspect of the abdomen. And it's kind of, people sometimes talk about it being like the mommy pooch, or, all these different words kind of get thrown around meaning the same thing. This just is a natural occurrence, but also can happen due to a pelvic floor that is not functioning properly or pressure that is not managed. And lastly, just want to throw this one out there as well. Pain with urination, sex, other activities such as exercise can also be found in connection with pelvic floor dysfunction.
And how often, so when you're working with women, how often are they, obviously you, and I know as through looking through your website and how you advertise yourself, this is something that you're promoting out there. This is what this is what the type of population I work with. And a lot of the women that I work with who are runners are coming to improve performance or coming for some kind of injury. They don't come saying there are these underlying issues going on there. So do you see a lot of women not speaking up, or men as well, if there are these underlying issues and just assuming that's just how it is, I need to deal with that? Or is this something that you feel like people are doing a good job saying, I need help with this?
It's interesting. I like how you phrase that, because actually I have been putting myself out there as, I specialize in this and talk about the injuries and stuff, but really the people who are coming to me, the women, majority of women, they'll be coming to me with back pain, with maybe prolapse concerns, like they're just having issues in the tissues down there, but they're not really 100% sure. Or the diastasis recti, or maybe hip pain, things that, they would not associate with it. But whenever I start my screening process and I start asking them these questions, they're like, oh yeah, well, I guess I am experiencing XYZ. And then we get to have a wonderful conversation about the connections of the human body and, the influence and impact that maybe their two cesareans had on their adductors or on their low back pain, or things of that nature that they never really, like you said, were concerned with or realized could be impacting their quality of life. And so the biggest thing for me now has been creating that correlation, helping them kind of connect the dots between what they're experiencing and what ultimately might be the root cause of their pain.
Very interesting. Yeah, very interesting. Yeah, because I see it's almost like it's not talked about enough, or it's not recognized, I think, which is also an issue, because we try to treat things and improve performance or rehab an injury. But if you're missing this, which from what you described could potentially be one of the most important areas of the human body from a function standpoint. It's almost like we're strengthening things, but we're not actually addressing that root cause, which can go missed. So do you think, I know you mentioned there are several different areas where we need to remember the pelvic floor. So on this next slide, injury, surgery, pregnancy. From an injury standpoint, how do you go about recognizing it's an issue? Obviously, are you talking about, hey, in addition to having hip pain or lower back pain, do you also have incontinence, or are there certain tests that people can do on themselves to understand if this is something that needs to be addressed?
Yeah, so great question. Because I deal with a lot of runners and things of that nature that come to me like knee pain, adductor pain, that deep hip pain, kind of like what you see with your performance people. They're going to come through and they're struggling with these different scenarios. And so for me, I might have a couple special tests that I run them through. But I mainly have questions that I ask. I start with a conversation because no matter who's coming to me, they have their own unique story. So if I can help see that story in a whole, it gives me a better picture and starting point to work from. So if somebody is coming to me with injury, maybe I do screen them for, incontinence, prolapse, things of that nature. But why you see other down there is because the pelvic floor is affected by both the sympathetic and parasympathetic nervous system. So it likes to, it's directly affected by the vagus nerve. It likes to be responsive to what's going on in our environment. So that means that, say you have experienced an injury, surgery, or are currently pregnant, maybe you lost your job, maybe you've had a death in the family, things of that nature, that is actually going to directly impact your pelvic floor. So the stress response of the body is to usually, protect the vulnerable areas. Well, down there is going to be pretty vulnerable. And so the body will naturally kind of, I don't want to say shut down stuff, but will protect. And so that could be, the pelvic floor tightening up, which I see in most women. It could be, different things could start just feeling a little wonky. That is the major impact to the pelvic floor that I think we don't discuss in regards to injury. So somebody who's coming in, maybe they did have an ACL tear, or maybe they had a hip labrum tear, which we see a direct correlation to pelvic floor dysfunction with hip labrum tears in the literature. Maybe that's what's causing their incontinence. Maybe the pelvic floor is actually, playing off that inflammation and causing more hip pain as well. There's multiple different factors that can go on there.
That's fascinating. Very interesting. And so a question that I want to ask right now, because I think it's relevant. Someone asked how to relax pelvic floor muscles after a workout and running. So is this only a running thing, or is this something else in the environment causing it? Like, how do you identify, I guess, what that is? It could be multiple things like you're mentioning.
Yeah, so that's the exciting part, because I'm a runner too. So this just brings out my nerdiness times a billion. So let's chat about this. Runners, we, especially us as women, we're pressuring ourselves. We might not even stop whenever we experience that incontinence or something of that nature. A lot of us, we like to pinpoint, okay, what's the cause, right? Like, what can I fix? And sometimes it's multifactorial. So I always like to advocate for us to start implementing strategies, like we'll discuss here in a slide or two, to start to kind of downregulate that pelvic floor, especially after a run and even before a run, just to get everything online in supporting the deep core and active through different techniques. But then also, like that individual said, kind of resting and relaxing through those tissues as well afterwards, because we need both. This is a very unique muscle group. It has characteristics that some of our other muscles don't. It has to be able to have that eccentric descent, or a very strong controlled relaxation. And so it kind of does play with people sometimes, where you're like, okay, after my run, do I need to strengthen it? Do I need to stretch it? What's going on? So the biggest thing for me, especially for runners, is, maybe afterwards going through different mobility drills that affect the muscles that go into directly or indirectly into the pelvic floor. That's where you're going to get the biggest bang for your buck, helping that systemic muscular, or like helping the whole system down regulate and relax after your intense workouts.
And those mobility drills that you mentioned, are those things that we commonly see? Is that like we're stretching the adductor and groins, we're doing pigeon, like do those tie into that? Or is this like a very unique, specialized type of stretching and mobility that's not commonly seen?
Yes and no. So yes, all those the pigeon, the butterfly, a wide-legged forward fold. I'm also a yoga instructor, and it's ironic that I see a tight pelvic floor in the majority of my yoga people who come to visit me, because there has to be a focus. You can't sit there and like many of us do, we're in a busy life, and hold a pose or a stretch for 15 seconds and move on to the next one. Or, we have to have a purpose. So driving home, relaxation breaths, driving home this like 360 huge breath and trying to soften through everything versus clench is huge. And that can really impact. And then of course there's some specific ones that I've learned over the years. The simplest one being rocking on all fours and sitting the hips back to your heels. That in and of itself can be very calming to the nervous system and pelvic floor. So you can go and find a bunch of fancy drills, or you can start really focusing in and fine tuning your purpose of the ones you're currently probably incorporating.
Oh, very interesting. It sounds like, this next slide almost sums this up. And what you're telling me right now, and what I've seen over the years, is Kegels is thrown at everything, but there's a balance of having that, the flexibility and the mobility area, but also the strength and the control. So what are some of the other things people need to really consider when it comes to the pelvic floor?
So I'm going to kind of say that I experienced this personally after my first kid. I actually went to go see a pelvic floor PT, and kind of get some knowledge and help after I experienced prolapse after my first child. And it was really interesting because I did not get much benefit from it. And it was mainly because a lot of it was focused on the Kegel, which is a great thing to learn. Pelvic floor contraction, because Kegel's just thrown around so much, I hate to use it nowadays, but a pelvic floor contraction is very important to master, But, we're not going to be thinking about every step of our run, oh, Kegel, 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 like that's not healthy. That's actually going to cause more dysfunction. So we need to be able to integrate this into our everyday life and our training. Because yes, you just said, usually we're handed a pamphlet and we're like, okay, you have a weak pelvic floor, here you go. Or you're having pain in your vagina, here you go. And that can be very frustrating for us as women, because we'll start to do that. And a lot of women that I've been seeing actually get worse. And that can be very, very, very frustrating. And so we always have to understand that the pelvic floor can be weak, but it can also be tight and weak. And so if you think about it, if you are doing a Kegel, like what do they say, like do 100 Kegels a day or something like that after a kiddo, or with pelvic floor dysfunction, and if you already have a tight pelvic floor, that's just going to piss it off, There's no easy way to say that. And so it's not just a problem in the pelvic floor. It's going to be addressing the system as a whole. You have to consider, the toll on the entire body, not just the pelvic floor. Was it something that happened separate from the pelvic floor, whether it was, a breathing issue, maybe now in the day of COVID, were you coughing a lot, sneezing? Was there some other impact that caused it? That's why I put, is it the chicken or the egg? What maybe do we need to look at to help this pelvic floor become more supple yet strong? For me, after having, such a frustrating response after my first child, I ended up having a second one, and I was so scared. I was like, oh no, it's gonna get worse. But I just kind of took what I learned from my first child and from the research that I had done, and I kind of created my own recovery program, my own thing. And I went back to another physical therapist afterwards, and just to kind of check to see how things were going. And actually, my prolapse was better than with my first one.
Nice.
I was actually better standing and doing exercise than laying on my back, which is something that's very unique. You don't really see that, because usually whenever you add in gravity and stress, you see things exacerbated. But just because of how I had been rehabbing and how I had focused my attention, it had actually helped me strengthen in those positions that otherwise might be weak. So I really focus on people whenever we talk about the pelvic floor, or something, going on, quote unquote, down there, that we're having a conversation about postural positioning, about breathing, about integrating these things, about training it and loading it. And you'll notice I said postural positioning, not posture, because it's not about having the perfect posture. It's not about balancing everything in the body. That's why I'm not perfectly balanced. That's not the name of my company. It's positively balanced. Because postural positioning is really taking a look at what's happening in those transition movements, what's happening whenever you're doing the activity. How are you able to carry yourself? Is that strategy working optimally for you, or do we need to tweak it? Because it's not all about something that I call your mama's posture. It's not about, chest out, shoulders pinned back. It's about looking and seeing what's optimal for your system and what might not be working so hot for your pelvic floor.
And so it sounds like it's almost like a combination here of a rehab physical therapy program and a fitness strength training program. Like all of those pieces almost like just blend right together at some point, correct?
It does. And that's why I'm now a huge advocate, because yes, I went to go see that pelvic floor physical therapist. It didn't work out too optimally for me. I still think that there's a place for internal exams, a place for things like that. However, in my practice, I don't do internal exams. I use external cues and feedback plus external modalities and things that I have learned and then cultivated on my own to help the things that maybe another person might go, internally for. Because I find that the body accepts it better whenever it's a part of that conversation. And so me, not going in, not having to affect it, or just, pressing on different things, instead having that conversation with the client, and that client having that conversation with the body, is where we see that result. And so me being able to kind of look at it from, my old fitness perspective, plus, getting into the newer strength and conditioning principles, plus the athletic training background, has really given me a chance in both my life, because I tested it out on myself first. And then also, having those conversations with my patients, it's really helped me gain a unique perspective and an appreciation for the pelvic floor and its relationship to the entire body.
Right. And that's so important, because I was reading something recently too, and they were talking about you don't know or fully understand something until you know and go through it. So a lot of times, like having that experience and that background of having kids and having your own struggles that you've gone through and researched and rehabbed and trained through, I mean, that only makes you stronger as a professional to really understand what other women are going through, rather than going to someone that, like me, who's never, obviously not a female, hasn't gone through these issues, to give recommendations where it's harder to relate to.
Well, and it's funny because, and I do want to bring this up here, because we always talk about pelvic floor issues with those who've had kids, or women. But I want to make sure that we understand as well that pelvic floor dysfunction does not discriminate. And pelvic floor dysfunction is like this umbrella, like vague term, but basically issues down there are not just for women who've had children. I have seen so many 16-year-olds, even 35-year-olds who love CrossFit, who love running, who are experiencing these same problems. They will be experiencing prolapse. They'll be experiencing diastasis recti, incontinence, because of maybe how they were managing their intra-abdominal pressure, maybe how they were lifting. All these different things will impact the pelvic floor. It's not just having a baby or experiencing a cesarean or something of that nature. It could be just inoptimal technique or pressure management, or like I talked about earlier, stress, which we don't usually factor in. There's so many other things that it's not just the pregnant postpartum woman that could experience this.
Right. Yeah, it's good to know. And I think need to do a better job of getting that out there into the world so people can recognize that, accept it, and understand this is part of the body and something can happen, rather than we always push it on, right? Push it on pregnant women or women that have kids. So as we begin to wrap up here, you mentioned 3 things that people can do right now to help your pelvic floor. So can you walk us through this?
Yep. So the biggest things that I see, especially with us women, we kind of want to look strong and toned, right? We want to have that flat body. We want to have, the flat stomach and gait, all these different things, cues from outside of ourselves, maybe social media or whatever the case might be. But here are 3 things that I notice all of us need to kind of check in with. So unclench your butt. Don't act like you're clenching $100 bill between your butt cheeks all the time. That is, allow those muscles to breathe, to relax. You don't have to clench it like it owes you money whenever you're walking through the grocery store. You don't, that's not, the body needs that relaxation in the movement, because tightening up those muscles will start to play into pelvic floor, will start to play into low back pain, like I'm sure you've seen with some of your people. Holding that tension in those areas whenever it's not necessary might be something for us to look into if you're experiencing any concerns. Another one is soften the belly, which none of us like to do. We like to kind of hold our belly button in towards our spine, kind of suck in, hold the gut in, especially for pitchers, right? It's like pitcher day and everybody pulls up tall and they suck in their belly. Well, I am here to tell you, let it go. Let your belly go, because this will help to allow it to absorb some of that pressure, allow it to not press any more pressure down into the pelvic floor. Because if you think about it, it's kind of like a pop can. If you're pressing in on the front, back, and top of or bottom of a pop can, pressure or soda is probably going to come out the top. So it's the weakest link. It's the thing that, might not be the strongest, will be where that pressure goes. So we want to make sure that we're able to have strong yet supple muscles throughout the entire body. And that includes the belly. So try to let it go. One of my best mentors, she said, 6-packs are sexy if they disappear whenever you inhale. And I will never forget her saying that, because she's like, they're not sexy if they don't disappear. And the more that I thought about it, the more it kind of made sense, because you have to be able to relax the muscle in order to flex it and have power and strength. Okay. The last one, don't forget to breathe. How many of us, I know it's silly, but have you ever noticed yourself watching a scary movie and you're probably clenching your butt, you're probably holding your breath, you might be sucking in, you might feel your shoulders next to your ears whenever you're watching that suspenseful movie, and then you finally and you're like, wow, okay, I was holding my breath. We do this in exercise all the time. because, we're thinking of different things. Us as coaches or trainers or whoever we are in the industry, we might be telling you, to have your chest proud or whatever the cue might be. So we're listening to them or dialing in on what they're saying. And then after the rep or 5 reps, we realize that we're sucking wind because we forgot to breathe during the exercise. So that those 3 things can have huge effects on the pelvic floor and more.
Yeah, it definitely sounds like it. And it sounds like as you look at Instagram and all the modeling and perfect pictures and holding our bodies in certain positions are almost exactly what we need to get out of, right? To just allow ourselves to relax and function and breathe and to let our bodies go and do what they're designed to do. So it's interesting you say all those. And so as we start to wrap up here, I have a couple questions. I know for some of you, we're 5 minutes over and we'll try to wrap up here in the next couple of minutes, but I want to get us started into the questions, just a few here. And if you have anything you want to ask, feel free to drop that in the chat box. I'll monitor that right now. So Cassandra, how do you know when the pelvic floor is too tight? And how do you find that balance? Like, is there a way to self-assess? Does it need to be strengthened or does it need to be stretched in some way?
So great question. A lot of times I'll go through like that symptom list. Like, are we experiencing that stress incontinence where like if we cough, sneeze, we're experiencing that leaking? Are we experiencing it on our impact and our stride, or is it after our run? All these different screening questions will help us narrow down what's going on. Also, different background things like eating disorder, PTSD, anxiety, depression, hip labrum tears, chronic low back pain, all these different cues will also give us an idea of, are we dealing with a strong or a weak pelvic floor? The biggest thing that I can say is I would just to say about 90% of the women that I see actually have type of, because of the society that we live in today. It's go, 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 right? So 9 times out of 10, it's teaching people how to do a correct Kegel or pelvic floor contraction, where we get that softening and relaxing, and then the engagement that we have to do. So no matter if you have a strong pelvic floor or a weak pelvic floor, we're going to be looking at educating it in the same. So for those of us who might be like, okay, is that me? Going through, maybe do a little mental checklist in your next run or workout. When are you experiencing your symptoms? Do you have chronic adductor strains? Do you have chronic hamstring strains? All of these will kind of key into that tight pelvic floor, and optimal pressure management, where we can actually go in and start re-educating the tissues and just kind of reestablishing that conversation between our brain and the tissues, to where we don't even have to think about it. Because I never want anybody to feel like, oh, I'm going to have to Kegel during my run and breathe and do this and do that. No, it's all about building up the strategies and kind of re-educating the brain and getting that conversation back online to where the body is able to do what it's naturally able to do.
Mm-hmm. And so kind of along those lines there, Stacey has a question. Would you suggest combining Kegels with other functional strengthening variations of squats, lunges? Do we combine those things together, or at what point do we teach it to carry over into those movements?
Okay, so great question. One thing that I want to break down is that we have to do our homework first. We have to do, you can't start sprinting before you decided to walk. Just like a baby develops, we have to make sure that we got down how to crawl before we run. I'm saying that right now because I have a 10-month-old and she's about to start taking off, so pray for me there. So you have to get that first stuff done now. So making sure that you're doing the correct pelvic floor contraction, not just contracting the pelvic floor and squeezing for dear life and then doing the exercise. No. Because that's actually going to exacerbate our symptoms. So that's where you really key in on working with the professional to where they're able to properly cue and integrate a proper pelvic floor contraction with your breath and exercise. Because especially if you've lost it and you're just like, I cannot, because a lot of people, they've tried probably doing a Kegel during a squat or something of that nature. And if they're doing like 110%, it might not work very well for them. So it's finding that pressure and that tension that you need for that load, and then be able to integrate that into your training, like your squats, like your deadlifts, because we want to have that orchestra of the muscles working for us, because you'll find a lot more strength, performance increase from having that coordination. That way you have that conversation and that orchestra working for you.
Interesting. And Claudette asks, what is the one exercise we should keep in our core routine no matter what? Have you seen there's a single exercise that you find that kind of covers most issues that you see, or is that impossible to say?
I love this question, because I'm gonna kind of say one that maybe people are like, huh? Breathing.
Okay, nice.
Yeah, because if you are able to do, I call it a crocodile breath or 360 breath, depending on what you're working on. If you're able to properly inflate and like release, relax, and then exhale, send that up and out, that is, I have seen more women tone up effectively from that, because they're using their muscles. It has the ability to expand to its fullest and then contract and give them that power. The funnest thing that I'm thinking about right now is I've been working with a vocalist. And ever since we started working together, you know, she's very active and she was very frustrated because she couldn't project, which is something, it's similar with runners, focusing on different things. And ever since she started, because I told her, I was like, okay, we're going to do the hardest core exercise you've ever done. Here we go. On your back, legs up. Let's start breathing. And she's like, huh? And sure enough, she ended up really appreciating and finding the benefit just from getting that expansion and contraction and power in her abdominals again.
That's awesome. That's great. So breathing needs to be combined with everything. It's not its own entity necessarily. While we squat, while we lunge, while we do core, if we're not breathing, we've almost gone too far with that exercise, correct?
Yeah. If you're holding your breath and you're turning purple, we need to have a conversation. Yeah.
That's awesome to know. So I want to be respectful of your time and everyone else's, even though I could probably sit here and learn all day because this stuff is fascinating to me. So as we wrap up, you mentioned you have a couple things for people. So yeah. What are the gifts? I guess if Santa comes from Oklahoma, what are the gifts you have this season?
Yeah, so Merry Christmas, y'all. It's gonna be, I'm doing some fun things here locally with some ladies, and I wanted to invite you guys as well. We're doing the 25 days of fitness. Basically, I am sending out an exercise a day for you to incorporate into your workouts. It's everything from maybe 5 minutes of an exercise to, I know I prescribed around day 19 minutes of yoga, because around that time we're starting to stress, and I actually send out exercises, I send out videos, so you're not lost on what you're doing, you're getting proper education. Also throughout this, I'm kind of giving different tips and deals on my services, as well as virtual services and women's health tips and tricks, especially around the holidays for de-stressing throughout this as well to those people. So that's my gift to you guys, because it encompasses a lot and will give you a lot of value and just help you get through the holiday season.
That's awesome. That's nice of you. So I'm going to share, I just shared the link in the chat box right now, so you guys all have that. It will also be going out this week in an email to you guys to check out. You said ladies. Is this only for women, or?
I do have a couple gentlemen in there, so it is for all. It's not just for ladies, so gentlemen, come on too.
No, sounds great. Sounds great. Well, we appreciate you taking the time to educate us today. I know I definitely learned a lot. I know everyone else probably did with this topic as well. Everyone out there that's listening, thanks for joining us on the Fireside Chat. Reach out. I'll send you Cassandra's information. Reach out with questions, because I think this topic and everything you covered, it stirs the pot, and a lot of things come to mind, like, oh, wait, I've dealt with this, I feel this. So there might be a lot of other questions for you. So I definitely recommend people reach out to her personally, ask questions, get involved, look into her services, because this is one area I personally see that's so overlooked and needed for most people. But we just throw hip strengthening at it, core strength, but we don't really focus on these deeper underlying things, and we neglect it. So Cassandra, I want to say thank you for your time today. I appreciate you joining us on the Fireside Chat, and everyone else, I hope you guys have a great week.
Bye, guys.